Hello and welcome to another episode of We the Doctors. My name is Dr. K. As usual on this show, it's not a one-person show. We are lots of people on the show. We have Dr. Yvonne.
Hello, you're welcome to the show.
And Dr. Valeria.
Hello guys, you're welcome.
I'm sure Dr. Valeria got shocked when I say we are lots of people.
Yes, I was wondering where the lots.
Three is a crowd. They say, yeah.
All right,
so we're actually
right.
lots of people on the show.
Yeah.
And today we're discussing a topic that has to do with lots of people. Let me explain what I mean by lots of people. We need lots of people to contribute to what we are doing today.
True.
And our topic is health insurance.
Yes.
Simply put, is a scheme for lots of people.
True.
Why is there lots of people flowing everywhere today?
Yeah, because it's a scheme for lots of people.
No, but let's make it clear. Health insurance is a scheme where you have lots of people pool money together and then to take care of the health of whoever healthcare needs, of whoever needs healthcare services amongst them. That is to say, we have many people contributing money, and if someone falls ill in that crowd, in that pool of people, the money they contribute will be used to take care of them. The question to ask is, how is it administered? How are you sure that there is no fraud involved in the process? And that's why in Nigeria, there's a formal system that started in 1999.
The National Health Insurance Scheme.
Yeah, where the NHIS now administers this scheme to ensure that there's no fraud. Now, by administering, what I mean by that is they monitor the work of smaller bodies called HMOs, who now take these monies and then pay to the hospitals, what we call the HCPs,
the healthcare providers,
who eventually provide a healthcare to the people that need them. I hope I've not confused anybody.
No. So simply put, it's just an insurance against, health insurance against high medical expenses.
Yes.
Basically. So, anybody can fall ill at any time.
Yeah.
But God forbid, it might be a time that when you don't have enough money to cater for it.
Yes.
So that's why health insurance is important. I remember one time like that, I met this young man who was an estate agent. And then he was talking to me about his wife having an ectopic pregnancy. And then he wasn't something expected. It just happened all of a sudden. And then he took her to the hospital and they said they needed to take her straight to the theater. And then the money he wanted to pay for it was 350,000 naira. From nowhere, he did not have that money. And he was wondering how he was going to do it and all of that. Thankfully for him, the doctor was nice enough to tell him to go and bring whatever he had at that point in time as deposit. They performed the surgery, and then before they discharged the wife, he went to look for money, borrow, and all those kind of stuff. Now, if, for example, he had the health insurance before that time, the health insurance hopefully would have covered that, depending on the plan that he had.
Exactly, I was about
so
to
then
say
again, it would have been an issue at that point in time.
Dr. Valeria,
yes.
If you ask the same person now,
to go
probably hasn't registered.
Yes.
Even after that experience.
Yes.
And that's the challenge we have since 1999. In a country of more than 140 million, we have less than 6 million people who are presently registered.
Yes.
And it's something that is open to everybody.
Yes.
And it's really surprising how people see the need for this, but they still don't see.
I think
still don't find the reason.
I think I also blame government a bit in this thing, because in our constitution, one of the things stated with regards to health insurance is that people may have health insurance. It should have been people should have health insurance.
So it is compulsory.
No, not try and defend. There's something different than that. There's a plan, because there's a plan.
I agree with you.
There's a plan to make it should, because it needs to be compulsory.
Yes.
You understand? Because at the end of the day, you are liable for the life of those people.
Yeah.
I actually believe health insurance should be compulsory.
Yes.
But you now have a choice to decide what type of health insurance you want to be.
Absolutely.
Yeah,
But the basic
on government health care, or you want to be on a private
Yes, because look at it today.
Yeah.
One of the major reasons why people don't go to hospitals, because they cannot afford it. You understand? Because of the treatment and all of that. By the time it gets to that level, before it even gets to that level, you should have been able to, go to the hospital to get some basic form of treatment and all of that kind of stuff.
These are topics that Dr. Valeria is very passionate about. So let's place a pause on Dr. Valeria and go to what we think is important. What are the objectives of health insurance? What do you achieve by having
to improve healthcare delivery? We all know that.
Okay.
Improve healthcare delivery. Many people, like he said before, do not have the access to go to, not because they can't go to the hospital, but they can't pay those bills at the time, as in when they really need these medical services. So having, as this HMO, also is an advantage to the hospitals themselves, because now they have more influx of patients. They direct them to different places depending on what plan they are on and proximity to their houses. So they have more patients and they're able to care for these people the way it ought to, thereby reducing mortality. So you see that it helps a whole lot in terms of healthcare delivery. So
that's true. Dr. Valeria.
Yeah, basically, it's also like an alternative, it's sustainable alternative source of funding because you know that any day, anytime, you can have your money there. If you have any issues, you can go and access your healthcare, basically. So, I mean, it gives, like what I was trying to explain to you earlier on, you have the peace of mind, you understand? And then talking about the mortality and all of that, look at our life expectancy, for example. 48, 52, dwindling figures. And one of the major reasons is because when people get to the bad state, they can't afford to pay for healthcare. But if you have a health insurance already...
They don't even have money to go when the thing is not yet in the bad state.
You understand?
So it progresses like that.
Not to talk of when it's in the bad state. And then they're asking you to go and buy blood. They're asking you to go and pay for surgery. Where's the money from? But already if you have the health insurance, it covers for all of those things. All you need to do is that you know that the hospital would provide the regular service for you and all of that.
There's also another beauty when you walk through a health insurance, when you use the health insurance, your hospital is under check.
True.
Yeah.
Because look at it this way. It is true it's your money that is paying for your health, but some other company that wants to make a profit is administering it. So they want to be sure, is the hospital delivering what we are paying them to deliver?
Yes.
True.
So someone will be monitoring the facilities the hospital has on your behalf. Someone monitors the quality of care you are getting from the hospital based on, of course, the premium you've paid. The one other thing to consider is if you have universal health insurance, at this point it seems like I'm speaking to the government. If you provide universal health insurance, that's health insurance across the nation, the challenges we have about equitable distribution of healthcare facilities, of healthcare itself, become solved. Because someone in the village can as well access healthcare services as the same person that is in the town.
Exactly.
And as the same person that is in the city.
True.
Is there anything higher than city?
Well,
You get so you have a spread across.
Yes.
So I'm in the city, I have an issue, I get to the hospital because I have a health insurance. Grandma who is in the village can also access the hospital in the village. And then we can also keep a tab on what is happening because the HMOs, for example, which are the organizations that administer this insurance for.
And regulates
These
what the healthcare providers do.
The HMOs actually monitor what's happening in the village as well as what's happening in the city.
True.
And that way there's healthcare spread across everywhere.
All right, we'll be taking a short break, and when we come back, Dr. Yvonne is going to be leading us to continue on this discussion on health insurance. Please don't go anywhere. Please stay tuned. We, the doctors, will be right back. Thank you.
hi, you're welcome back. It's We the Doctors. We'll be talking about health insurance. I'm Dr. Yvonne, and on this segment, we'll be talking about the scope of health insurance and also the benefit one gets from using health insurance. Health insurance, in short, is insurance against the risk of accruing medical expenses amongst individuals. That's the shortest definition I can give concerning health insurance. So talking about the scope of health insurance. Normally health insurance, we talked about it before, saying that it's supposed to be open to everybody, being as mandated by the government the way it ought to be in the way it works in other countries anyway.
Should be, yes.
Exactly the way it should be. But talking about the scope now, it's ideally open for like a spouse and 4 biological children, like they say.
Yeah.
Below the age of 18.
Below the age of 18.
Yes.
I have a problem with that word biological, so I always say children.
Okay, children.
Let's leave.
No, but I mean, that's the term.
Yeah.
The term basically from any child will say that.
Biological or adopted.
Yes, they will say that yourself, your spouse,
Yeah.
and 4 biological children under the age of 18. But there are some plans that, even if you have 10 children, that can cover for it, as long as you can afford it. That's the most important thing. There's some plan that you will say that you want to cover for some family members and all of that.
You can even cover your entire village.
It's even better. You know what some people even do, especially those in the diaspora, they do like health insurance for their parents and their family members. So instead of someone calling you for money every time, you know that you have health insurance for them. They can go to the hospital and get benefit of healthcare, which makes a lot of sense. Yeah. Basically. And then it takes us to the benefits of this package.
Yeah.
You understand? You have things like outpatient service. You can go in, you can go and see the doctor. I have headache, I did not sleep well at night, I have this, I have that. The doctor will examine you like a proper doctor seeing you. You also beg benefit of doing investigations for free because you have paid for it, I mean, sometimes the money is not even much. Anyways, I'm still the one we do right here is, I'm not sure of the amount, but I'm sure it's nothing so much out of the norm. If you check it, probably you're paying like 2,000 naira every month at the end of the day.
The thing about it is, it's not we're just looking at about the money. Fine, money is involved in these things. But even if the plan doesn't cover for so many things or the very serious things, but if you're able to catch these things early enough, then you can know how to try and get money to do the major things.
A lot of things, family planning, and then the part that touched me the most is the maternity care.
Yeah.
Because whether you like it or not, unfortunately, for some reason, the environment there's a high maternal mortality and infant mortality, and that's because people do not get access to good quality healthcare during the course of delivery. You still find people going to meet traditional birth attendants. I'm not saying
That
it's super
they're not,
wrong, but I mean there are some issues where you don't go there. First pregnancy, what are you doing with the traditional birth attendant in case of of any emergency
complications or anything?
or pregnancy that has some issues? You know, hypertension in pregnancy, diabetes in pregnancy, twin pregnancy. You go and still meet the traditional birth attendant, and there's a complication as a result of that. But if you have health insurance, you can get access to good health, quality healthcare.
Yeah.
As a result of that, you can do your family planning. You go there and say, look, there's even immunization, all these vaccines and all of that, basically. Also for the child, which also prevents illnesses in the child. You know, we can go on and on and on and on.
But
even cosmetic reasons, it depends on the plan. If you want to go and be doing the one where you can be doing both lifts and augmentation and all those kind of stuff.
We're talking about the basic things now.
No, I'm even telling you, it covers everything. You want to remove all your teeth and turn everything to good. It depends on the amount of money you're paying on your plan.
There's something else that comes up. Because they mentioned this cosmetic, let me push to the challenges we have, a few of the challenges.
Yes.
We have issues with how some of our people think in Nigeria. Someone is placed on a scheme for health insurance. He decides to abuse the scheme.
True.
Let me explain what I mean by that. He goes to hospital by 2 a.m., leaves the hospital by 2:30, gets back by 6 a.m., leaves the hospital by 6:30, goes to work, comes back from work. He says he doesn't feel
because he
feels
yeah. You know, there's some people that are like that. I paid money for this thing. I must enjoy my money.
The person saying it is like that.
Because you know that. Because you know that you're entitled to it.
But that abuses, you have to understand that abuses the aim.
Yeah, no, but the doctor, no, that's why the doctor is there. To also be the one to decide. If a doctor will see a patient, he knows when the patient is real.
Now, the next
when the patient is
problem is the burden he places on the healthcare system, because you have, let's say we have just 10 doctors to attend, and we have just 10 ill people. By right, you should see 10 ill people and you're fine. But when you have 20 people malingering, pretending to be ill because they feel they need to take up whatever they've, whatever they've paid for, forgetting that it's meant to be a collective thing. And some come under the pretense that, yes, you taught us preventive healthcare, let's come and prevent
and check my BP and check my sugar.
And then they fill up the hospital reception, and people don't get access to health on time because someone else came in there earlier to abuse the system.
No, but even in the US, there are some investigations that you go to the hospital. For example, you go and say you want to check your genotype. They tell you that it's not covered. There are some things they know that it's just an abuse of privilege.
That's an abuse of privilege. I'm looking at, in the US, you have a facility that you walk in 5 minutes. Sometimes you see a doctor, sometimes. But you have a system, you wait for 30 minutes. And then you're waiting for somebody that has come to abuse the system.
That also depends on the kind of healthcare provider you're using.
That's true.
You understand? And so it might be a facility when you walk into and then get to see a doctor early enough.
And talking about these healthcare providers, it now raises another problem because people want to abuse the system. The healthcare providers now start their own mago. I have to say it here. I'm a doctor and I'm saying
doctor, okay.
That is true. They now start their own system because they want to. Imagine I've gotten some money from the HMO, for example. Maybe the HMO gave me 600 naira per head on the assumption that the person is not going to come. I have 1,000 people on my scheme for 600K. One person alone has taken off the money through a CS. How do you expect me to manage the remaining money and still post a profit?
Those are the challenges.
Those are the challenges
with health insurance. Those are part of the challenges with health insurance. Anyway, we'll go on the street and find out what people think. I think the question today is, do you have a health insurance? I'm sure very little.
How many people actually do have?
Yeah, let's find out from the street. With the doctors, we'll be right back. Let's go on the street and find out from people if they have health insurance. Thank you.
I don't.
You don't have?
I think there has to be a process on ground for us to be able to really access the health insurance program.
It's not that I don't know where to get it, but I have where I attended for my health care.
Through a public service organization, Nigerian Immigration Service. I have a scheme there with their insurance, health insurance scheme there.
Let me say I don't know how to get.
Hello and welcome back to the show. You are still watching We the Doctors. My name is Dr. OK. Earlier on, we've been discussing NHIS, HMOs, health insurance in general. And for today's interview segment, I have carried myself out of studio. I'm right now in the head office of Oceanic Health Management Limited. And I'm speaking with no other person than the Managing Director of Oceanic Health Management Limited, Dr. Charles Onwuzligbo. Dr. Charles, welcome to the show.
Thank you.
It's a straightforward one, and I'm going to ask it the same way our viewers and the audience have been asking. What is a HMO? Do we need HMOs? Simple.
Yes, everybody needs an HMO. And the reason is not far-fetched. An HMO, which is a health maintenance organization, is an organization set up to coordinate, manage access of the insured, that's the client, the enrollees, access to the hospitals, who are the health providers, after negotiating or agreeing over a set of premium, which is the fee they pay to have access to the hospitals. Now, in Nigeria, what an HMO does is they tend to liaise with either corporate clients, people in the market, the informal sector, the corporate organizations, to be able to come together, have a pool of funds together, to be able to access care at the hospitals.
Now, you know, there are people on the street that market this thing, life insurance. Is a HMO, what you are marketing, for example, as a HMO, is it different from life insurance? How is health insurance different from life insurance?
Okay, for both life and health insurance are all insurance products. However, they are different. For life insurance, it has to do with death cover, and also for, especially if there's a case of an accident or so, to be able to cover the person, even for some medical cases. But however, for health insurance, you find out that health insurance is an intangible product. You cannot be able to hold on to a particular this that you said, this is what I'm holding to. But when you buy a health insurance, you have access to health in terms of either preventive, curative care. What I mean by preventive, it is not just limited to just going to the hospital.
Okay.
You'll be able to take information about how your well-being, how to make sure you live healthy and others. And then the curative is to be able to make sure whenever somebody falls ill, you'll be able to attend hospital and take treatment.
Now, when we deal with patients, you hear them say things like, okay, since I'm tired of this HMO, why won't I go? Let them give me my money back. Is it possible in health insurance? You know, in life insurance, people can say, okay, at this point, I'm pulling out. They are not dead, but they can pull out. Now, in health insurance, can I get to a point and say, they've collected my money, even though I know it's a group thing, let me go and collect my money back? Is it possible?
Okay, for me to answer this question, we need to understand the dynamics of health insurance, especially as relates to HMO operations, especially in Nigeria. Now, most HMOs guidelines are gotten from the National Health Insurance Scheme, who is the regulator of the health insurance program in Nigeria. The HMOs get accredited, and based on that, they have set of guidelines that guides their set of processes. Now, for an insurer, which is the HMO, to now be able to say, I'm giving service to an insured who is the client, there must be a set of contracts. The contract will now determine, by the time the premium is paid, over a set of periods, you can decide whether it's a short-term insurance or a long-term insurance. The long-term insurance, typically a 1-year period, can be more than 1 year, 2 years, or thereafter, depending on the terms and conditions of the contract. While in some cases you have short-term insurance. But typically, it's a premium paid over a period of 1 year. That's the policy period. Now, what this means is that there must be an agreement to set of services. There must be an agreement of how the care must be gotten. And bear in mind that this is just like a social
Healthcare system,
care.
yeah. Okay.
And what this means is that it is not just what you pay that determines the level of care you get in the hospital. Let me take, for example, I pay 1,000 naira. The access to 1,000 naira is not limited to what you get in the hospital. You can access care that is worth more than 1 million naira. What this means is that as one person brings in his premium, other people brings in their own premium, and they have a pool of funds. That pool of funds is kept together to ensure that whenever any of those members have a need to attend hospital for care, that money is now used to take care of that person. Now, the question you raised, if I no longer want, will I pull out? In some certain cases, depending on the terms and conditions of the contract, it may be applicable. But usually, it's ever a particular period. And what this means is that once you already have a contract within that particular period, you are bound to respect that.
Now, let me ask it the way they ask it. Somebody says, January, I brought 1,000. February, 1,000. December, 1,000. A total of, let's say, 12,000. And they've not gone to the hospital. And end of December, he wants to know, can I go to the HMO and collect my 12,000 naira back? Is it possible?
It would have been possible, but however, the case is not.
Okay.
The reason is this. In January, people pool resources. And the basis for the contract is that some people
Will be sick.
Will be sick, while some people may not be sick. So it depends on how many, the percentage that utilize that scheme. However, what has been paid into that pool is used within that particular period. So you find out that whether you are the one that utilizes the scheme or you are the one that is helping another person.
Hello guys, and you're welcome back to We the Doctors. If you're just joining us, we have been talking about health insurance. My name is Dr. Valeria. In this particular segment, we're going to be giving you tips, or more like enlightening you further about health insurance. Now, on this segment, we're saying that what are the things that you should consider, you should look out for when you're trying to get health insurance. First, you do that, you think about the HMO. All right, and now this has to do with employers and individuals, because most of the time, people that have health insurance, they get it through their employers anyways.
Yeah.
So, and then for individuals, if you're going to pick a health insurance, you want to watch the HMO, be sure that this HMO that I'm taking really cares about me. You want to be sure that the HMO, what the plan is from the HMO, look at it very well. All right, if you don't understand some things, you can go to a doctor and say, please help me check this plan. Which one will make sense for me? Which one would be of benefit to me?
You know, one thing that is funny is when we want to take out insurance for our cars,
yes,
we're very serious about it. Yeah. When it comes to healthcare, you should be more serious.
True.
About
no, you
your
see,
health.
because the thing about why they are serious about it, in a way, is because when you get stopped
it's money used
by
to buy
police,
the car.
no, when any law enforcement agent stops you or by the roads and they're asking for insurance, is while when
no,
you
but
don't
people
have
talking
it.
about total cover, full package insurance.
Yes.
So the guy wants to know if you bash my car today, am
If
I
you will
going
be able to get
am I
something,
going to be
exactly.
jumping bus
True.
till
Tomorrow.
using public transport till they provide me a car? Insurance firms go as far as saying, okay, if you bash your car, send the while we're investigating, we'll give you a chauffeur-driven car.
Exactly.
And they move you around.
Exactly.
We check all that when we deal with our car. Why won't we do the same thing
with the
when we
health,
want to pick
yeah.
health insurance?
Because there are some health insurance that, you know, gives you very good plans, gives you a lot of opportunities. They will tell you things like air ambulance.
Yes.
In case you need to travel out, they will take you out, they will take you to
anyway,
the best.
that depends. You know, when we had the
facility.
interview, the MD was explaining the fact that there are premiums attached to this thing.
Yes,
so
yes.
Don't just go tomorrow and say, doctor, I'm ill. I know you can treat me in this hospital, but I want to fly to
I want to go to
My
India.
HMO, it doesn't work. It doesn't work that way. Really.
Yeah. Another tip to consider is the healthcare providers themselves. We talked about this before. So you want to get a hospital that is close to where you stay, as in that's proximity to home. Make sure that it's a registered facility. That one is very important.
True.
And also that they are good doctors, obviously. Good doctors are everywhere. So just to make sure that they're very competent and
Are good doctors everywhere?
Well, in most cases, anyway, if he's a doctor, registered doctor, licensed, however.
What my tip will be is to ask yourself, what's your employer stand on having health insurance cover? And when you talk about your employer stand, you also ask yourself, is my employer going to cover just me alone, or is he willing to cover my family as well? So when you think about this, it helps you decide it's time to take out a health
And then you can
insurance.
also encourage your employer. A lot of
true.
people are working and they don't have health insurance. You understand? And then you want to go to the hospital, your company is not even ready to pay your hospital bill. So it makes life very easy. If they're not providing clinical service for you, they're not providing, hospital service for you, you're not seeing a doctor, let them at least register you and get a health insurance plan for you and your family. So that when you are sick, you have a place that you can go to. Sometimes I think it's a combination. Your company pays some part, you also pay some part. Whichever one you guys want to negotiate and make sure that you get a health insurance for yourself and your family. Dr. K, what questions do we have from social media?
I picked this question because because the person that asked the question bears the same name with you.
His
His name is Wale. Wale was asking that where do I register for health insurance?
Okay.
And how much is it? We'll take his question in parts. Where do I register? First of all is to where do I get information for health insurance?
True.
If you are working, Wale, walk up to your HR today and ask, this is our health insurance. How do I join? How do I get registered? That's one. Then if you are not working, you can walk into any hospital close to you and ask the hospital facility. I heard you guys accept patients from health insurance companies here.
Most hospitals do anyway. You always see this signboard, NHIS out there.
Yes.
So you can go there and ask them. They can direct you to their own HMO.
Simple.
You understand? So if there's a particular hospital you like, for example, so you can walk up to them and ask them if they accept health insurance.
Yes.
If they don't, then you look for the one that accepts health insurance close to you.
And
They will recommend their
they'll
HMO
recommend
to you.
and tell you which one to use.
Absolutely.
If that doesn't work, when you drive around, you find offices of the NHIS. You can go to the internet now and type NHIS.
National Health Insurance Scheme.
National Health Insurance
Yes.
Scheme. If you type it in now, you'll find addresses and where you can go. Or you can even type HMOs in Nigeria in your browser, and then you get a list, and you can visit or call any of these numbers and get yourself registered. I think that's the answer for how and where do I get health insurance. The next thing is how much does it cost? That will now be determined by which HMO
And the plan you're
and
getting.
the plan you are joining.
Exactly.
Because
Like
if
he
you
was
want
talking about air ambulance
if
and
you
the
want a
rest of
plan that
them.
will,
Yeah.
air ambulance, for example. And anyway, let me mention, most times the air ambulance is actually evacuation back home. If you went to get, or if you fell ill outside the country, evacuation back home. So if you want to take off one as air ambulance, you know, good soup, we say. Money cooker.
That money killer. All right, that has been our show for today. We have been talking about health insurance. Remember that you can send up your questions at our Twitter handle @WeTheDoctors. And then you can go on Facebook, facebook.com/WeTheDoctors. And if you miss any of our episodes, you can go on YouTube and just type With the Doctors. So we see you the same time, same thing. We are saying goodbye, guys, and stay healthy.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.